Welcome back to Golden Aging Health. Have you ever wondered what your doctor really thinks when you walk into the room? Most seniors would rather not imagine it. But behind the polite tone and the quick nods, there are often quiet assumptions about older patients. And those assumptions can shape the way your symptoms are heard, how your treatment is planned, and even which options you're given. Research from Harvard Health and the National Institute on Aging shows that healthcare seniors often face a silent form of medical bias that elderly patients rarely talk about. Warning signs may be brushed aside as just old age, or serious conditions may go undiagnosed because of stereotypes. That is not only unfair, it can shorten both health and independence. In this video from Golden Aging Health, I will uncover 5 harsh truths about senior healthcare. These are the realities many doctors will never say out loud, but they matter deeply for your well-being. Along the way, I will share senior wellness tips, elderly wisdom, and practical strategies so you can speak up, ask better questions, and claim the care you deserve. Stay with me to the end, because the final truth may completely change how you approach your next appointment. If you find this information useful, please like, share, and subscribe so you don't miss out on valuable health tips for people over 60. Now let's start with the first harsh truth every senior needs to know. Truth number 1. Doctors see seniors as too expensive and complicated. One of the harshest truths is this: some doctors quietly assume that older patients are too costly and too complex to treat. The moment they see your date of birth on the chart, a mental label is applied as elderly, multiple conditions, limited benefit. According to a report from the Journal of the American Geriatric Society, JAGS, nearly 30% of physicians admit they sometimes scale back testing or treatment for seniors, not because it is medically unnecessary, but because of assumptions about age, cost, and outcome. That means instead of receiving individualized care, you may be pushed into a standardized, one-size-fits-all path. I once heard a story about Mr. Harold, a 74-year-old neighbor of mine. He went to the doctor for recurring chest discomfort. Instead of ordering a stress test, the physician brushed it off as heartburn from aging digestion. 2 months later, Harold suffered a heart attack that might have been prevented with proper screening. The solution is not to accept this bias silently. Come prepared with a short summary of your medical history. Set clear health goals like, I want to stay active enough to play with my grandkids, and request a specific exam time to discuss them. Write down questions and do not hesitate to ask, Doctor, how is this plan tailored to me? This first truth already shows how powerful hidden assumptions can be, but what comes next may be even more surprising. Truth number 2. Gaslighting symptoms as just aging. Another harsh reality is that many doctors quietly dismiss serious health problems by labeling them as just aging. This form of medical gaslighting is surprisingly common. Instead of digging deeper, a doctor might say, "That fatigue is normal for your age," or, "Of course, your memory is slowing down, you're getting older." The danger is clear. According to Mayo Clinic research, conditions like thyroid disorders, depression, cardiovascular disease, and even early cancer often present with subtle symptoms, fatigue, low mood, and weight changes that can easily be brushed aside as part of aging. The National Institute on Aging warns that this mindset delays diagnosis, which often means the disease progresses to a more advanced stage before treatment even begins. What can you do? Present a timeline of your symptoms, ask for specific tests, and use the powerful question, if I were 40 years old with these same symptoms, what would you recommend? This reframes the conversation and forces your doctor to separate aging from illness. Have you ever felt your doctor dismissed your symptoms as just old age? Share your story in the comments. Your experience might help another senior recognize the same pattern. And stay with me, because in the next truth, I will share the hidden assumption many doctors make about seniors' mental sharpness and how it can hold you back from receiving advanced treatment options.
Truth number 3. Assuming seniors struggle with understanding. Did you know that many doctors automatically assume seniors cannot fully understand medical details? They may slow their speech more than needed, oversimplify explanations, or avoid offering advanced treatment options, believing an older patient would not be able to manage them. The problem is not only disrespectful, it can also be dangerous. Research published in Harvard Health shows that seniors who are engaged in their care and fully informed about treatment options have better health outcomes, especially when managing chronic diseases like diabetes or heart failure. Yet, if your doctor automatically assumes you cannot grasp the details, you may never be told about the latest therapies, surgical procedures, or clinical trials available. I think of my friend Evelyn. She's 70 now and as sharp as the day she was teaching math at the local high school. When she went in for her arthritis, her doctor quickly offered pain pills and told her to stick with gentle exercise. That was it. Evelyn later found out from another clinic that people her age were being considered for advanced biologic treatments that could actually slow down the disease. She was frustrated, not because she couldn't handle the information, but because no one had bothered to give her the chance. The solution is to show your capability early on. Mention your background, whether professional, educational, or personal. Ask for detailed treatment plans in writing, and do not hesitate to say, I want to hear all available options, even if they are technical. Using tools like health apps or electronic records also signals that you are engaged and capable. This truth reminds us that being underestimated can quietly limit your choices. But what comes next exposes an even deeper issue that few seniors ever expect inside a doctor's office.
Truth number 4. Medications used as a form of control. What if the pills you are given are not always prescribed to heal you, but to make you easier to manage? This is one of the most troubling realities in senior healthcare. Reports from the American Geriatric Society reveal that sedatives, strong sleep aids, and certain antidepressants are often prescribed to older adults in nursing homes or hospital settings, not strictly because of medical need, but because they make patients calmer and easier to control. The problem is that these medications come with serious risks. The Mayo Clinic warns that overuse of sedatives in seniors increases confusion, dizziness, falls, and long-term dependence. This practice turns medicine into a tool of convenience rather than care. And when seniors are not encouraged to ask questions, these drugs can quietly steal independence, energy, and even years of healthy living. So how can you protect yourself? Always ask, what condition is this drug treating? What is the goal of this prescription? How will we know when to stop it? Request regular medication reviews, and if possible, involve a trusted family member to help oversee your treatment plan. Before we wrap up, let me ask you something. Do you make it a habit to question your prescriptions, or do you usually take what is given without asking? Share your thoughts in the comments. I would love to know how you approach this.
Truth number 5. Calculating the value of a senior's life. I remember a story of Robert, a 72-year-old veteran who wanted surgery for a heart valve problem. His doctor admitted privately that if Robert had been 50, the surgery would have been recommended without question. But because of his age, the discussion shifted toward comfort care. Robert felt like he was being measured not by his health, but by how many years he might have left. This reveals a harsh truth. The healthcare system sometimes calculates whether treatment is worth it based on quality-adjusted life years, a measure of how much value each year of life is expected to bring. According to the National Institute on Aging, older adults are often steered away from costly surgeries or advanced therapies under the assumption that their years ahead are fewer or less productive. The problem is that this reduces a life to numbers, not human dignity. Robert refused to accept that reasoning. He brought his medical history, data from similar patients his age, and even consulted a geriatric specialist. In the end, he received the surgery, recovered well, and now enjoys daily walks with his grandchildren. His determination proved that seniors can and do benefit from advanced treatments when given the chance. The takeaway is clear. If you ever feel your options are being limited because of age, ask your doctor directly. Would your recommendation be the same if I were 45? Bring medical evidence if possible, and do not hesitate to seek a second opinion from a geriatric care specialist. This final truth shows the deepest bias of all, seeing years of life instead of the value of life itself. So let's take a step back and look at the bigger picture. We uncovered 5 harsh truths about how doctors may quietly view seniors. Some see older patients as too expensive and complicated, cutting corners in care. Many dismiss real symptoms as just aging, delaying diagnoses. Too often, seniors are assumed to have declining mental sharpness, limiting advanced treatment options. Medications are sometimes used for convenience, not healing, placing seniors at risk of confusion and dependency. And finally, the healthcare system may even calculate the value of your life and withhold treatments simply because of age. These are difficult realities, but they do not define your future. What matters is that you now know how to protect yourself. Ask clear questions, request evidence, present your goals, and never be afraid to advocate for your rights. As the National Institute on Aging reminds us, seniors who take an active role in their care consistently enjoy better health outcomes and longer independence. Your age does not reduce your worth. Your wisdom, experience, and presence are irreplaceable, and every one of us deserves care that respects both our dignity and our potential for healthy years ahead. If you found these insights valuable, please like this video and subscribe to Golden Aging Health so you never miss new senior wellness tips and empowering guidance. And let me know in the comments which of these truths surprised you most. Thank you for watching. Until next time, take care of your health, take care of your spirit, and remember, you have every right to be heard and respected.